Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to this episode in the AMA Steps Forward podcast series. I'm your host, Dr. Kevin Hopkins, a family medicine physician and senior physician advisor here at the AMA. The value of effective teamwork in medicine has never been more widely understood than it is today. The reality for many medical practices is an unmanageable workload spread across too few people. We're more dependent on our teams probably than ever before. As we consider how best to care for patients in these circumstances, delegation of work to those best suited for it is increasingly necessary. As physicians, we know that the social determinants of health have critical consequences for the health and well-being of our patients. A community health worker, a frontline public health figure who's a trusted member of the population they serve, can help bridge the gap between our healthcare teams and our patients, linking them with essential community resources like nutrition services, affordable housing, and education. To discuss how to implement a community health worker into a team-based care model, I'm joined by our guest, Veronica Sek, Adjunct Professor at Malcolm X, a City College of Chicago, and Business Services Manager at Sinai Urban Health Institute. Thank you, Veronica, for sharing your expertise with our listeners today.
Really happy to be here.
Thank you. So before we delve into our topic for the day, would you please, Veronica, tell our listeners a little bit more about yourself than what I was able to describe in the intro, a little bit more about yourself and your background?
Yeah, sure. So my name's Veronica. I use she, her pronouns. I am a white woman who is also a first-generation Polish American. And I've been working in community health for 15 years now. I started my career focused in the food system and health education and communication, and later joined the workforce development side, where over the last 5 years, I have trained community health workers, including contact tracers and vaccine ambassadors. And currently, my primary focus is on building partnerships, specifically to expand community health worker apprenticeships. My background is in public health. I have my master's in public health from the University of Illinois in Chicago. And I'm currently working on my doctorate in public health focused on leadership, advocacy, and equity at Tulane University.
Awesome. Okay, what an interesting background you have. I've got to admit, as a family physician, I am not sure what a community health worker does exactly. I mean, this is what seems like a relatively new role. It's probably not as new as I think it is. Can you describe for me and help me understand, what does a community health worker do?
Yeah, absolutely. I really love to reference the Community Health Worker Consensus Project. It's really easy to look up c3project.org, which was completed by a variety of stakeholders, and it really outlines the roles, the competencies, and the qualities of community health workers. Community health workers look different in every organization and setting depending on the needs of that organization and community. But community health workers provide health education, they provide culturally competent and appropriate care, linking individuals to information. They can support with case management and coordinating care. They can help individuals navigate their healthcare benefits and insurance. So they provide a variety of services, as well as outreach, which is really significant, is engaging the community as well. Really, that role can look so different in every organization. You'll also notice that the job titles change too. We've done studies where under the umbrella of community health work, there's hundreds of titles. So I would even include in there contact tracer, vaccine ambassador, patient support specialist, outreach worker, care coordinator. There's so many roles. So that's why I think we also could get confused about what community health workers do. Now, we've been adopting the title community health worker primarily more and more, which has been really exciting because it provides a clear message of who community health workers are, but still you'll see that variety. But their primary role is to be that liaison for community members, for patients, and be that connector and support between the healthcare system and individuals.
That's super helpful. So, a couple of key roles that I heard you describe involved in health education. I mean, certainly we know that there is wide disparity in health literacy among our patients and the general population. And so that seems like a really key role, helping to coordinate care, healthcare navigation. I heard you talk about in there. Our health systems, especially the big ones, like the one I work for, are difficult to navigate. And I work in it. I'm a physician. I have direct line phone numbers to call people, and sometimes I'm not sure how to navigate the health system. Do you find that that's a big barrier to patients out in the community to receiving the best health care that they could potentially access, is just knowing how to do it?
Oh, absolutely. I mean, it's really difficult, and having that individual who one is building a relationship already with the community member. So they know them a little bit more than surface level. They're starting to build that relationship, understand all the different factors in their life that influence their ability to care for themselves and for their loved ones. And then, two, having that knowledge of who to call, how to navigate something, what the different systems are, or what the resources are available. Having that follow up of letting someone know, oh, hey, their appointment is coming up and this is where they should go, because maybe we know that somebody always gets lost to this specific office, is really helpful because it takes off some of that stress that someone might already be experiencing, right? Going to a care visit. Eliminating those factors also helps an individual be more engaged within their healthcare and within the healthcare system, because they don't have all these different barriers to receiving that care. Navigating one's healthcare and health is already sometimes so taxing emotionally, and then to have to work through complex systems to get what you need can be really really hard and demotivating. But at the end of the day, as a physician in healthcare, you have only so much control and ability to support someone. And having that community health worker on your team can be a huge benefit and value add, ensuring that, wow, there's someone who is almost holding the hand of the patient so that, the next time you see them, they have progress.
From the perspective of medical practices and healthcare systems and healthcare organizations that are struggling to retain employees and struggling to recruit employees into healthcare for various reasons, including things like just workload and burnout and those factors. It's actually really encouraging to hear of a segment of healthcare workers that there seems to be growth and excitement and desire and interest in. Who would be the ideal candidate for a community health worker training program? You had to see a lot of people come through your program, and maybe there were some that had characteristics, personality types, those types of things that did better than others. Who's the ideal candidate or person to do this type of work?
We're looking for individuals, one, who are very compassionate. They're friendly, they're dependable. Every community health worker, they have a story and a reason and drive for why they do the work that they do. So that's who I would look for in a community health worker, especially if you're someone who's on a hiring team and the community that you serve. I would look to hire someone from that community. They're going to be your best advocate and person to take on that role. And that's our goal too, is that community health workers come from the communities that they serve. That could be geographically, that could be culturally, that could be someone who's had a similar experience. So maybe if you have somebody who is a breast cancer navigator, right? Maybe they themselves have had breast cancer, or someone, a loved one, has had breast cancer and they've been part of that journey that they've experienced. So it's someone who's really has some of that intimate knowledge that typical healthcare worker may or may not have, because you see a variety of people and patients that there's no way you be able to connect with every aspect of those individuals.
So people who come from or have an association with the community they serve, people who are compassionate, friendly, dependable, open-minded, empathetic, all those make great sense, probably for anybody that works in healthcare, but especially somebody who's a key connector and linker of patients to programs and services. Do you have any idea how many community health workers there are in the U.S. workforce today? And are most of them employed by health systems or insurance companies or public health departments? Who are they and where are they?
The estimate that in 2022 there was about 67,000 jobs, community health worker jobs. There is a growth rate of 14% right now, so definitely higher than average, as you can imagine, expanding that front line within healthcare to alleviate some of that burden and workload that is on healthcare professionals right now. So I would say in urban areas, there's definitely a lot more community health workers than in rural areas. I think a lot of that has to do with just the amount of population as well as resources. But there are definitely a lot of projects working on expanding community health workers even more in rural areas. There is a lot of opportunity. I think the more awareness we have around this role and how we can integrate it into care teams, I think the more we'll see those roles pop up as well.
So who are the employers? Who are the biggest employers of community health workers?
Biggest employer is definitely community-based organizations. They're on the ground, they're sharing resources, they're connecting individuals to different support programs. So those are the biggest employers and have been for a very long time. But now we're seeing an increase of community health workers becoming employed in federally qualified health centers, hospital systems, research universities. I've even seen them hired in the academic space as they engage with community, especially as the potential of their services being reimbursed under insurance is expanding.
So thinking about that expansion and movement of community health workers into practice settings like FQHCs and health systems and hospitals, those types of things, how could you foresee or how have you seen this type of role be integrated into a team-based medical practice where we are as a collective group responsible for and engaged in the healthcare of a population of patients?
Often community health workers start to get integrated at the beginning of someone's care plan because you want them to be a linkage along the way in building that relationship. They're also the person who's kind of calling and following up with an individual. And then along the way, we're also training them to share what they're capable of and able to support with so that the care team can adopt what makes sense for them. One of the community health workers I work with recently mentioned that the reason that the patient they were working with was not complying with their care plan was because they were so worried about their son, that their son was really struggling with mental health and they were really worried about them. So they were prioritizing their family member over their own care. So this community health worker found resources for the son to get connected with a support group, which alleviated that stress for the parent who was getting cancer care, and they were able to then engage more within their own care because that stressor was alleviated. So really, it's hard to kind of pinpoint exactly what they can support because it's so many different things. It's really all those determinants.
Mm-hmm. A couple of things those stories made me think of. I have a few patients who are marginalized in society. They don't have family, and oftentimes I feel like they just come into the office just really it's a social visit. It's their socialization, and that's not nearly enough for them. I think of one of our other practices that's in a significant area of Cleveland that is primarily Spanish speaking, and because the primary care office, the family doctor's office, they're the helpers in the community. Their patients will bring stuff to them that is nothing to do with their healthcare. They'll bring their bills, their things that they don't understand because of the language barrier. And, we don't have enough social workers and other folks to sort of go around and stand in this gap. And so I'm just thinking of all the different use cases that exist for people to be connected who are otherwise disconnected. Are there other significant impacts that you've seen or you anticipate community health workers being a crucial connection for?
Yeah. Well, one, I just want to identify that just within our conversation here, I love how you're already realizing how community health workers can be a value add to the care team. So that makes me so happy because I hope that anybody listening will start to, have those pings because you're right. Bills, like helping navigate bills, whether it's how to pay them or even maybe not having the income to pay them and being connected with a program to get them paid or supported with it is something community health workers can support with, and at the end of the day that is some determinant that is impacting their ability to care for themselves. There's a great amount of research now that shows how community health workers improve health outcomes and lower healthcare costs. I do want to reference the National Association of Community Health Workers that has lots of resources on their website. Community health workers can support with chronic disease management, which also can support reducing healthcare costs, such as unneeded emergency room visits or hospitalizations. They also increase access to care. So they're that bridge between healthcare providers and community members. So they build that relationship and help people re-engage. And even thinking back to the COVID-19 pandemic, they support public health goals. I mean, we had many goals during that time to connect people to resources, to do contact tracing, to ensure that individuals weren't further spreading COVID, to then getting people linked with and educated on the vaccine so that we can get nearer to ending the pandemic. The value and the outcomes that come from engaging the community health worker workforce as part of the care team, part of healthcare and public health is really valuable.
Anybody that we could bring into our team that helps to support public health goals, access to high quality medical care, help us achieve better outcomes with our patients and lower the total cost of care and increase patient engagement. I mean, it makes a lot of sense. So I really appreciate you sharing your expertise. Are there any other key pearls of wisdom as we wrap up that you think would be important for our listeners to know?
Yeah. We are at a crucial time in history where we have so much technology and medicine and research, and we have created waves already in what we can do in health. But I think we are reaching a pivotal point where some of what we have can only take us so far. And now we need to reconnect that community aspect, like we're focusing on the social determinants that impact someone's care. And I believe and know that by including community health workers as part of this conversation and remembering that public health is not just during pandemics, but happens every day, all the time, is going to be so crucial in us adding more years of quality lifespan and longevity and have people feeling like they're really thriving into their later years. And community health workers are definitely gonna be a key aspect of us reaching that point.
Well, there's been so much invested in technology solutions, those types of things, automation to help us be more efficient in our work. And yet there are many circumstances that remain in which people still make the difference. And it reminds me of our vice president for professional satisfaction and practice sustainability at the AMA, Dr. Christine Sinsky, wrote an article about the need for radical reorientation of the U.S. healthcare system around relationships. And while all those things are great, it still boils down to relationships that makes the key difference in helping our patients get and stay well. Veronica Sek from Malcolm X, a City College of Chicago, and the Sinai Urban Health Institute has been our guest. Thank you so much, Veronica, for sharing your knowledge and experience with us. Listeners can find any resources mentioned in the episode description. Until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.